Okay, so we were going to make a video, and we're going to talk about frame fit. So a lot of people buy glasses. I am one of those people that we get a lot of individuals and patients that come in, and sometimes they're not fitted properly. So if you are looking for glasses and you need some tips and tricks, and we're not even ordering them online, anything like that, just something to look for when you're looking at those glasses. So we have 3 points of contact that we want to have. I want to have your nose. I want to have the top of the ear and top of the ear. We don't want the sides to touch. We don't want them to squeeze your head off, okay? So we want to make sure that they're very comfortable for you, all right? So we're going to have Courtney put on a couple different pairs of glasses. If you want to come over here now, you can look at her. All right, so she's trying on a Vogue frame. Now, while we might not like the specific style of this frame, it does actually fit her fairly well. We're looking for the pupil to be centered within that lens, especially if you have a higher prescription. We're also looking at the side of the head. We're looking for that bow. Do I have enough room to move it down? Sometimes if people are very active, we need to move that down in order to keep it up. Do our nose pads sit correctly? So this is actually a really good frame for her. Little tight here, but this is also a very skinny lens. If I put her lenses in there, it would be a perfect fit. All right. Option number 2. So you already can see, I don't know if you can see it on video, you see these temples are going to start squeezing her sides. What that's going to cause is a major headache. The bridge is also a little wide, so this is sitting further down on her nose. Smile. Cheeks are going to touch. You're going to have a lot of makeup coming off on cheeks, oils, anything like that. We're going to get dirty very quickly. If you look at the bow, this isn't terrible. We would have enough to bend if somebody insisted on having that short of a bow, but overall, love the style. We don't like the fit though, do we?
I don't like it.
It's squeezing, isn't it?
I don't like it.
Yeah, we're going to squeeze your head off.
No.
Okay, so we're going to put her in something a little bit bigger, and it's going to be too big. So this is a men's frame. We pulled it just because it is big.
To be comfortable in the bridge right there.
So you're going to see the bridge is way too big. If I can do a lot of this where she should be sitting up here, the lens is too wide. And then if you look back here, we got a lot of bow that I'm going to have to bury behind her ear in order to hide it. This would not be something that I want to do. This way it fits okay, but she's going to have a lot of problems with adjusting and pushing her glasses back up on her nose. Okay. Let's go for the Polaroid. Okay. So this does not actually have a bad fit. She has a really good centered pupil in that lens. If she's somebody that was using a PALS or a progressive multifocal lens as we get older, this would actually be really great because she has enough lens here to use that reader, but we're also not going all the way down into the cheekbone here. Little tight here, but like I said, this is kind of one of those things where if I put in her lenses, I know what her prescription is, I would have a lot more give to it to spread it out. Bow wise, this is actually a really good fit. If she needs to curve, if it starts slipping down, I can curve that behind her ear. What do you think of those?
They're cutesy, but I don't like the aviator style.
A little squared for you?
A little
Well,
bit.
it's a little too squared,
Just
yeah.
a little bit.
Not exactly Top Gun.
No.
All right. Go ahead and put those on.
I wanted these ones originally.
So since Courtney is a single vision patient, we don't use a PAL. This would actually be a really good lens for her, except for that cheek touching. She doesn't like her cheeks touched, apparently. The nose, the bridge is a little bit bigger, so if we wanted to put it up, we would be doing a lot. I would be doing a lot of movement behind her ear here. This is kind of one of those things where it's like sometimes patients like the big frame. That is what is in style. We can say no or we can say yes. We do like to give advice if we feel it's too big or if it's sitting too low. But the customer is sometimes right, and they like what they like, right?
Yes.
All right. Now,
I think those are tight ones.
these are, yes.
They're cute.
So we did pick out a few that are going to be too tight for her. This, you can already see it's pushing in right here. I can't even put a fingernail in there. If you look to the side, you see that bow? I don't have much room to do anything with that. So if that starts slipping down, we are pretty much at God's mercy and just squeezing her head to keep it up, okay?
It's not God's mercy.
Yes, we kind of are. If it was wide enough, this wouldn't actually be a bad fit for here. But you can always already see it's kind of starting to squeeze off her head with how much pressure it's putting on her temple and on the side of her face.
It's just uncomfortable too.
All right, so we got the frame that Courtney actually purchased herself. This is a really good fit with her eye. If she had the multifocal lens, it is a little deep on the cheek, but she does use these as a transitional lens for sun protection. She has a really, really good range on that bow, so we can definitely bring it down. Obviously, these are not hers, they're just a demo, so I'm not going to do that while other people are going to try it on. The bridge does fit a little low, but it's actually really nice on her nose. We don't have a lot of movement. If you have too much movement, then you kind of notice that it'll start hitting the sides of your nose and it actually gets kind of sore. The other thing to look at too is if you do have somebody that has a bigger bridge or a narrower bridge, the bigger bridge, if this sits too tight, you're going to have markings. It's not going to feel good eventually, and you're not going to wear the glasses. If you're somebody that has a very narrow bridge or a very flat bridge of the nose, so if you look at her bridge, she has a very prominent bridge. Most of us do, but some people have it too, where it's too narrow. That's where we go back and we look at the nose pad, because that gives us a lot more give to squeeze it in, do some arrangements for them. I hope you guys learned something about glasses today. Summit.